ACE is what created WACCBIP. There was no WACCBIP before the ACE, so we were created with the funding that we got from the ACE project. And as you can see, the ACE project was like a seed that was sown, and then other funders have quickly come on board, and we have more than doubled the funding that we received from the ACE. So we are a baby of the ACE project. We are a poster child for what the ACE project can do in terms of establishing centers of excellence, and then the impact that it can make. 4 years on, we have given fellowships and training opportunities to 150 scientists from across 10 countries. These include 90 master's students, 50 PhD students, and 12 postdoctoral students. And all these have come as a result of the ACE getting all this started and giving us the opportunity to establish this training program. Yeah, so that's one of the reasons why we're having these research conferences, to showcase the research so that it's in the public domain. So today you'd hear research ranging from infectious diseases to non-communicable diseases. I can give you a few highlights. We have a student whose research looked at just the air in hospitals. So he sampled air in hospitals, and then he found that there are very dangerous bacteria in the air in the hospitals. Some of these bacteria are even drug resistant. So you can imagine going to the hospital for one disease and then contracting a disease that is even more dangerous, And this is something that our student has done as part of their PhD work, and this is going to be put out during this conference. We have another student who has detected dengue in Ghana. I'm sure nobody knows that we have dengue circulating here, but dengue virus is circulating. One of our students has purified dengue virus from children in Accra, and this is the first time that the virus has actually been detected in Accra, which shows that there's local transmission of dengue. It's not that they got it from somewhere, because the children never traveled. We asked for their travel history, they haven't traveled. So that means that they got it locally. So the virus in circulation, this is something that the Ministry of Health needs to aggressively monitor before it gets out of control. We have a student looking at hearing impairment, working in the communities with the hearing, families with hearing impairment. And we're trying to find what are the genetic markers that cause this condition to be transferred from father to child and mother to child, and so on and so forth. Our approach has just been that we take the best women scientists who apply to our programs, and we take the best men and we put them together. So it's an equal opportunity. Women compete among themselves, men compete among themselves, and we take the best from both sides and put them together in one class. And you realize that once you put them in one class, some of the women start to outperform the men, and so on and so forth. So that's our approach. When we have 100 applications from men and another 100 from women, we take the top 10 women and top 10 men, we put them together in one class. And So about 40% of our trainees are women. We're trying to get to 50-50, but this is basic science, which is not one of the strong areas that women have been very interested. So we're trying to get the interest up and more women interested. So we're hoping to get to 50-50, but now we are probably 40-60. So this is to put our data out there, to put the work of the young scientists in the public domain, so that healthcare officials, ministries of health, Ghana Health Service, industry partners, everybody can see what is being done, and hopefully the information will be used, to improve our healthcare delivery in the system. So all these studies I've mentioned to you, these are studies that should be taken on board in designing health policies and the way things are done at our health facilities. So that's basically what we're trying to achieve, is to put the information out there so it can be used.
My name is Dominic Salamiel Amuzu. I'm a PhD student under the WACCBIP Deltas scheme, and my research work is on malaria. I am looking at receptors and how the genetic aspect of receptors and how they affect invasion with respect to the parasite destroying RBCs. My research is going to impact the efforts towards elimination of malaria, in the sense that the blood stage, there are 3 stages of malaria. The blood stage is the most destructive stage, where RBCs are destroyed, and this is where the parasite actively enters these red blood cells using receptors. So my work is to understand how the pathogen interacts with these receptors and is able to effectively enter the red blood cells. Precisely, I'm looking at a receptor called the glycophorin B deletion. So I want to see how this deletion impacts on the effects of the parasite invading these red blood cells and destroying them. Effectively, it will allow for designing vaccines to target these receptors and effectively prevent the parasite from entering RBCs. And also we could design drugs that can block this pathway. The project has really impacted me positively because at this part of the world, funding is very difficult when it comes to education. And the purpose of WACCBIP, therefore, was to train young scientists in the field to also lead other young scientists and come out with a bigger network of scientists who will be running cutting-edge science while we still lecture with them. And personally, this has really improved on my skill set as a researcher and also as someone who is thinking outside the box and looking at solving problems. Ultimately, I feel this program is going to become a generational thing where those of us who are being trained right now will be able to also impact other young ones, mentoring them and bringing them up. Personally, I've had an opportunity of even traveling outside to University of Oxford at the Wellcome Trust Center for Human Genetics, where I designed some assays for screening this genetic variant. And while over there, most of the skills that I've learned there, I've decided to bring it back home and then use it to improve the system that we have here to a better level. So this is how far the program has brought me.
Yeah, I'm William Eklo. I'm a PhD student at WACCBIP. I'm looking at drug resistance to trypanosomes. We've seen that most of the drugs which have been used for trypanosome infection, especially in animal, has developed some resistance. So we want to look at what are the mechanisms which are involved in this drug resistance. So that is what I'm working on. So one of the things we have seen is that even though trypanosomiasis in humans is on the low, we have seen that for animal trypanosomiasis is on the increase. And we know that in Ghana, for instance, and Africa, for instance, one of the major things that happen is that we are involved in most agriculture, livestock production, and therefore, if this disease will cause a reduction in meat production, cause infertility and all that, then it's something that we need to concern. One major thing that we also need to be concerned is that even though the human disease is getting low, one of the things we have observed is that the animals are serving as reservoir for the human infective form. So it means that if these animals are not treated properly and we humans will take it, then those the human infective form which are reserved in the animals we can enter and will cause a major problem to humans. And therefore that is why we think that our research is very important. So once we're able to get the mechanism, then we can develop new drugs, and therefore we can stop some, or even not to reduce it. So that is what I'm doing here.
Okay, my name is Pearl Ihoma Osiriki Program in Molecular and Cell Biology of Infectious Pathogens, and I'm in my first year. My research is on characterizing the mechanism of action of some trypanocidal compounds. Yeah, so the trypanocidal compounds are compounds that kill parasites, trypanosomes specifically. So I have some promising starting materials. They are compounds that have been isolated from Nigerian medicinal plants. So I want to understand how those compounds kill the parasites, literally. So the parasites are organisms that cause disease in animals and humans. So the strains of the parasites I'm looking at are the ones that cause the disease in animals. So I'm looking at the animal disease. Before coming here to Ghana, I'm a lecturer in University of Benin, Nigeria, and towards the tail end of my master's program, I started to develop an interest in infectious diseases. My master's was on diabetes research, and we didn't have the capacity to do that kind of research in my institution. So when the fellowship that I have here came, I was really very excited because WACCBIP, as I'm sure you know, provides excellent training for biomedical researchers. And aside the training, there's funding too. So those were some of the things that attracted me here. And so far, it's been a very beautiful experience. We have lecturers who are highly skilled and are ready to raise up young scientists that will change the landscape of research in Africa. So I'm really glad for the opportunity to be here to receive that training, also to mingle with the future leaders of science here in Africa and worldwide, in fact, because we are configured for excellence and global impact, actually. So it's been a very beautiful experience. Yeah.